One of those powerful adult near-death experiences is the one of Dr. Robert Kennedy, who was murdered and survived. He said, "What I learned from my experience is we do not die alone, as you would fear. That your loved one who has died in the most horrific circumstances, perhaps, does not die alone, but dies immersed in a sea of love. A love that taught me that the meaning of this life is to learn to love like that. Or even more important, to learn to be loved."
And that was because he left his body while he was being attacked. Is that right?
He completely left his physical body while he was being murdered. He was
Right.
able to sort of almost dispassionately. In fact, he had tremendous compassion for the man who was trying to murder him. Well, he was in a sea of love. And he came back to life because this will tell you everything you need to know about the neuroscience of near death experience.
If you are one of the people out there who have been drawn to near death experiences because you're trying to discern if they are real or not, or if they are a figment of our imagination, then this interview is for you. My guest today is Melvin Morse, who is an expert in child near death experiences. He was featured on the Oprah Winfrey Show many years ago, and he has helped lots of children to understand and integrate their near death experiences. And not only that, he is a wealth of knowledge in the near death experience community with brain cognition and how these near death experiences really work. And he's here today to show you that we actually have science behind why these happen. And one more fun fact, he's actually the brother in law of Dr. Raymond Moody, the father of near death experiences. So, Melvin, welcome.
Very
Thank
true.
you so much for joining us today.
Well, it's such a pleasure. I come to this field as a critical care physician. I was trained at
That's
Johns
right. I
Hopkins.
forgot to introduce you as
Yeah.
Dr. Melvin Morse.
So, so I come to it from a totally different angle than you, Lori. Really, when I trained at Johns Hopkins, I was taught when you're dead, that your brain creates consciousness, all the typical stuff that you've heard. And all that changed for me. Um, as a critical care doc, I was out of Seattle Children's Hospital and I worked for Airlift Northwest. So we
Hmm.
brought in, you know, children from Alaska, Montana, Idaho, Oregon to Seattle Children's Hospital. And I'll never forget that I resuscitated, well, my team and I resuscitated the 7-year-old girl who almost died in a community swimming pool. She was
Wow.
underwater for 20 minutes, and yet she completely recovered. So she's truly near death. We worked on her for hours. In fact, it was at the point where I thought she was going to die. I thought that our efforts were in vain. And I told her parents to come in, and they prayed around her bedside and said goodbye to her. And that's how close she was to near death. And yet she survived. And I happened to see her. My mom, who's had a near death experience, always says there's no coincidences.
I
Um,
love that. I agree.
I, I just happened to see her as a coincidence in this clinic I was working at, sort of part time. And I saw her in the hallway. I said, "Oh, there's Crystal Merslock. Hey, Crystal, I know you don't remember me, but I sure remember you. We spent a grueling, 5, 6 hours working on you." And she looks at her mom, Lori, and she goes, "Oh no, I know that man. He stuck a tube in my nose."
She
And she
remembered
then
because she saw it from another vantage
she
point, didn't
saw it
she?
from another reality. And, she told me, well, first of all, she described her entire resuscitation, uh, blow for blow. even chance comments that the nurses made. I was calling my mentors up at Seattle Children's Hospital. What should I do next? Nothing's working. She heard me say that. She said, I saw you take me into this big machine that looked like a donut, which was a CAT scanner. And then she said she went to heaven and that she met Mark and Andy, who were friends of hers who were waiting to be born. Um, she said she looked down and she saw her brother to be below her. And then she sees the look on my face. I'm like, oh, great. I mean, this was a deeply religious Mormon family. I just thought this was all just, I don't know, just born of her, what she'd been taught in Sunday school. And she looks at me and she goes, Dr. Morse, heaven is fun. You'll see.
So was she the
So
catalyst for you because she was able to give you that evidential information about I saw this, I was here, you did this, and there was no way she would have been able to know from your training and understand and tell you those things unless she was having some kind of an experience that really was a near death.
she defied the neurology that I was taught at Johns Hopkins because
So what were you
since
taught? What were you taught?
that the brain creates consciousness, that once we were all tiny little cell organisms and they became more and more complex, and finally, to what we think is the pinnacle of brain development, and that the consciousness is almost a byproduct of the brain. And so obviously, when your brain dies, consciousness dies. And
Right.
that's a um, scientific speculation. Frankly, there's no evidence to support it, and it's easily 100 years out of date. And the modern science thinkers, like Robert Lanza, who's been heralded as the world's smartest scientist, he says it's consciousness that is the substrate of the universe. Consciousness comes first, and then consciousness comes through our brain, allowing us to interact with each other. And it's consciousness that affects these little microorganisms and, all the rest of reality. There's even evidence from a scientific standpoint that rocks are conscious, that the natural world is conscious. That is no longer some touchy feely, uh, spiritual philosophy, but it's grounded in the hard sciences. So, that, but this was early in my career,
Sure,
but I
right.
knew
So
something was up.
Crystal was how long ago for you? 25 years or so ago?
Oh,
More?
easily. Well, I was in my 30s, so yeah, it was well over 30 years ago. So,
Wow.
people often say, well, wasn't she seeing something? Maybe she's coming in and out of consciousness. No, we tape their eyes closed because we want to make sure that, no little bits of dirt or, they don't have a blink response anymore. I mean, she's so profoundly comatose that she has no blink response, no gag response. She had, a 1 in 10,000 chance of living, and yet she did. And yet she was able to tell me all the things that happened to her when she was clinically dead. And listen to what she said. This is her testimony, Lori. She said to me, I wasn't dead. I wasn't dead at all. Some part of me was still alive. And she was astonished as you and I. Well, not you, because
Not
you've
me
been in that
anymore.
soul
Well,
place.
but at the
But for
time,
many
you
of your
had to have
listeners,
been completely astonished. What were you thinking as she was saying this to you?
I thought this was, I don't, first I thought it was probably an artifact of her own imagination. This is just something that's a product of training. But then I also started thinking maybe it's from the drugs we give them. Maybe it's from the lack of oxygen to the brain. Maybe it's from the stresses of being in a scary intensive care unit. And I returned to Seattle Children's Hospital to sort out those questions, to really do a scientific study of what were these experiences. And I already knew that it wasn't part of her religious imagination because she told me that she crawled up a brick lined tunnel to heaven and she was met by a woman named Elizabeth who said, "I'm here to help you." Well, in her family's religion, there was no Saint Elizabeth. There was no one named Elizabeth who had previously died. There was no, uh, Mormon theology that you crawl up a brick lined tunnel to heaven. So already I understood that this was, uh, contrary to what she was taught. In addition, um, I asked her parents, I said, "So what have you told her about death?" And she said, "We taught her that the spirit is like a hand in a glove. So when you die, the glove comes off, but your hand still is alive." Well, there was none of that kind of imagery in her experience. So I returned to Seattle Children's Hospital, and just to brag for your listeners, because I'm always hearing that science doesn't support the near-death experience. Well, we scientifically studied um, all survivors of cardiac arrest at Seattle Children's Hospital over a 15-year period of time. We didn't accept volunteers into our study. We had to advance who we thought was near death. And we didn't tell them this had anything to do with near death experiences. We labeled our study the psychological effects of being in a pediatric intensive care unit. And we had very specific questions we could ask them. What do you remember about the time you were in the hospital? And that was all we were. So we didn't have leading questions. We couldn't say, "Did you see a light?" Or anything like that. And we carefully compared them to control patients who also had a lack of oxygen to their brain, were treated with identical drugs, were also intubated, mechanically ventilated, also had extremely serious illnesses that, through common sense, their parents and the child thought they were going to die. But we as physicians knew, most likely they're going to make it. So we compared those two groups. And I found to my great surprise, I mean, this is what I did learn from my Hopkins training, is that when you design a scientific experiment, it has to be sound enough that you're going to accept whatever answer you got. And we were unprepared for the answer we got, which was that 24 out of 26 children who survived cardiac arrest, which, unlike you see on Grey's Anatomy, by and large, if your heart stops beating, that's really bad. You're unlikely to make a full recovery if you've had a cardiac arrest. And yet, our children who did survive also had a memory of an experience that they localized to the time they died. Our control patients who had the same lack of oxygen to their brain, well, they fit the neurology I was taught at Johns Hopkins. They couldn't remember anything about being in the hospital. Well, that's what, we believe about the brain. The trauma interrupts your short-term memories and you don't have any memories. So what am I talking about exactly? So we interviewed this one girl, Lori, that I had to stick a needle in her heart to resuscitate her. And you can see her picture that she drew that's reference to the time that we stuck this needle in her heart. So she had no memory of coming to the hospital. She had no memory of being in the intensive care unit. She had no memory of going home. except she said, but wait a minute. I do remember when you asked the nurses for that crash cart thingy. And then I was out of my body. And she says, and I saw my grandmother. And I was just so shocked to see her. And she drew me a picture of her grandmother sitting in a chair, surrounded by a bright light. And, you know, one reason that it's very important to me to share these experiences is that I heard these experiences for the first time from children who had never told them to anybody before. Why not? Well, as one child told me, she said, well, I didn't think you were supposed to be able to talk to God. So she didn't tell anybody about her experience, nor had this little girl. But she says to me, I was so shocked to see her because, of course, her grandmother had died. Well, that's a real experience. And then she looks at me and she says, with this puzzled look on her face, well, then I was back. And I said to her, well, what do you mean you were back? And she goes, that's what I'm trying to figure out. So the idea that these are products of our imagination, are born of the cultural religious experience, does not fit the stories that we heard. What we heard were fragments of a powerful experience that they themselves are struggling to understand. You have to hear these experiences for the first time. Then you know them. I agree that when I heard Crystal Merzlock's experience, this is the craziest thing. But after I started interviewing survivors of cardiac arrest, we resuscitated a young man who had a cardiac arrest on the floor of the lobby of Seattle Children's Hospital. He had a pacemaker that failed, and we resuscitated him. And he looks up at me and he goes, that was weird. You guys just sucked me back into my body. Well, that is not something he's making up. And I can tell you, Lori, that I've spent my career trying to answer the question of are these experiences real? And I'd like to share with your listeners why.
Okay. Yeah, I would really be curious about that.
So, because this impacts on everyone's life, because we've
Mhm.
all had some sort of spiritual experience. And frankly, most of us, that was a weird dream. Oh, that was just a crazy widow's hallucination. That was that was a mother who just so desperately wanted to see her child who had passed, that then they saw their child at the foot of the bed, but it wasn't real. So here's this young man's story. His name's Chris Eggleston. His parents were ski instructors. They were coming home from the Cascade Mountains about 10 o'clock at night, driving snow. Their car skidded down the steep slope, hit a guardrail, flipped over the guardrail, and plunged into the river below. They were, 20 feet underwater. And Chris survived. So, as an intensive care unit doc, we know you're not dead until you're warm and dead. He was in freezing.
Why
It's
why
true.
why are you not dead until you're warm and dead?
Because when you're cold, it slows down all of your body processes. So people can survive, um, being in icy, freezing water 20, 30, 45 minutes. I'm not saying it isn't a miracle. His
Okay. Yep.
survival was truly a miracle.
Yep.
But so listen to his story. I have a picture of it for you there. He draws a round circle that has a rainbow inside it. And again, I'm interviewing him for the first time he's ever told this experience. And going by my protocol, I've got this list of questions that are, you know, Human Subject Review Board Committee instructed us to say. So I said, so what do you remember, about the time that you were underwater, that, before you came to the hospital? And he looks at me and he goes, oh, do you remember, are you saying when I was in the huge noodle? I said, the huge noodle? And he goes, oh, no, no, no. It couldn't have been a noodle because noodles don't have rainbows in them. And then, Lori, after he's told this experience and he hears what a near death experience is, and he's trying to explain it to others, he never talked about the noodle again. It's only that first time when he's trying to figure out what the heck happened to him. He was in the huge noodle. He went to what he called animal heaven. A bee gave him honey. And then he went to the human heaven and then, returned to consciousness.
Did you
And
say
then he
he
looks
went to an animal heaven?
in animal heaven. Yeah.
I've never heard that before. I've interviewed lots and read lots of these stories. What did he mean by that?
Well, he told me there was a bee in it and that this was a place for, where animals went.
Huh.
But I love what you just said, Lori, because embedded in what you just shared is that each person has a unique experience.
Yes.
You can't say that these are born of our cultural conditioning
Right.
because each one is so weird. It's so odd.
As
That
unique as we are people.
exactly. So he's not making this up. He truly, that's how this experience presented to him. Why? We don't know. And then he looks at me and he says, but was it real, Dr. Morse? Because if my experience was real, then you've got to tell all the old people.
Oh, how old was he?
I don't know, he's 8, 7 or 8.
Oh, I love that.
I know. You got to tell all the old people. But then his mother said to me, yes, I want to know if his experience was real. Because if his experience was real, my experience was real too. It
She had
was
had
not.
one also?
Here's what happened to her.
Wait a minute.
She,
Hold on. I just want to make sure I'm on the right story. This is the family whose car went into the water 20 feet
that's
under
correct.
and he survived, and the mother survived also.
Exactly.
Okay.
And here she said, until I heard Chris's experience, I thought I just had a crazy widow's dream. So here's her experience.
Okay.
When she went underwater, she was able to kick out the glass of the windshield and she came to the surface. And the first responders were there. And they took her, to the side of the river, covered her with blankets, etc. And her husband was driving the car. So there she is on the rock, and she looks over, and there's her husband. As real as this experience is, not a ghost like, Hollywood portrays these, but it looked exactly like her husband. And she looks over at him, and she's, what are you doing? They're down there trying to save our son. And one son had died, did not make it out. And, they're diving, and you're just sitting here doing nothing. And he looks over at her, Lori, and he says, everything is all right. Everything is exactly as it should be. Please do not cry. This is how it's supposed to be. She was furious when she heard that. She's like, what are you talking about? This is how it's supposed to be. Uh, you know, uh, and she was so angry. She like, you know, pounded on him, and he disappeared. So she had what we call an after-death hallucination. Hallucination. But she accurately pointed out that if her experience was real, then all of these spiritual experiences are real. The premonitions of death, the after death experience, the after death communication, the shared dying experience.
Mm.
And, spoiler alert, we actually have the neurological hardware in our brain that allows us to have these experiences. So if near death experiences are real, then even those who have experiences during meditation, during typing class, uh, spontaneously, those are the same experiences using the same pathways in our brain. And those are, in fact, just as real. And this is important to point out because we can't really scientifically study an after death communication. We can't really scientifically study a meditation induced spiritual experience. We can't truly prove if there's a God or not. But one thing we can do is study the near death experience, as we did. We showed that these are real experiences that occur in the, well, when patients are clinically dead and they're not caused by all the things that we think they might be: lack of oxygen to the brain, etc. Unless you think that this is not science, every once in a while I'm on Facebook and they go, isn't this some kind of pseudoscience? Lori, we published our articles in the American Medical Association's pediatric journal. So they're
Well,
not.
let's tell everybody why that's significant, because we're going to talk about statistical significance and credibility. And I think that this lends to those things because it's just not a subjective somebody saying, this is what I think. There's actual p-values, right? There's actual
Absolutely.
statistical significance. We explain to everybody watching what that means because not everybody's versed in those things.
So that's why we had a control group. So we wanted to see and compare, how many patients in our experimental group, those who were clinically dead, had some sort of experience at the point of dying. We accepted everything. Whatever they said happened to them, we accepted as a near death experience. So we weren't constrained by, what Raymond Moody, my brother in law, said was a near death experience. Not at all. And then we carefully, as you're saying, statistically compared them to the experiences that our control patients had. But in our case, we didn't have to do any statistics because none of our control patients, hundreds and hundreds of control patients, had no memory of being near death.
Why
Those
do you think that
patients,
is?
they weren't close enough to the border. The near death experience, as we know it, as what happened to Chris Eggleston, has to happen when the brain is dying. Think about the typical experience. Um, the person first is plunged into darkness. Well, what is that darkness? That's the cessation of sensory input, hearing, vision, etc., from the body. But the brain is still conscious.
Right.
But it's no longer able to bring in the sensory experiences. The brain creates reality from the specific sensory experiences. We have biological sensors in the back of our eye, in our ear, on our body, our skin, and then our brain takes those sensations and creates this three-dimensional experience that we have. Well, when the brain dies, that all disappears. But unlike what I was taught at Johns Hopkins, consciousness doesn't disappear, but instead they're still awake. As Crystal said, some part of me was still alive. And then it's after that they have this journey, be it down a tunnel, be it just a simple out-of-body experience. Frankly, I think all of those things are just our human brain after the fact struggling to to label it in some way. I still like what my
Yeah.
little girl said. I'm trying to figure it out.
I love it.
We
All
don't
right, I have a
really know.
question. I have a medical question for you because
Yes,
I think one of the responses that people have is that they say you had a near death experience because of a certain medication, whether it was an anesthetic or another medication that you took, and that was what caused your brain to have the response. But I
sure.
think I heard you say on another interview that it's the opposite, that a lot of times it's the medications that suppress the ability for you to remember. So will you explain this to people who are watching so they can understand this part?
Okay. This is so crucial. Those of you who are skeptical, I share your skepticism. When we did our study, which was done at Seattle Children's Hospital with the head of the intensive care unit, the head of the Department of Psychiatry, the head of the Department of Neurology. So we are the mainstream. And we actually thought that anesthetic agents caused this experience. So that's why we had our control group. All of them were treated with the same anesthetic agent, but none of them had the experience. So we were wrong. In fact, subsequent research that we've done has shown that medications actually suppress the memory of the experience.
And why is
So,
that?
well, because they cause amnesia. Um,
Mm.
and for a specific reason. Many times when patients are put under anesthesia in the hospital setting, they're still awake. They may not be feeling pain, but they're still awake. Just as, an artifact, that they're just not, brought into a depth of coma that's necessary, etc. Well, uh, anesthesiologists don't like that. So they typically give patients powerful drugs which induce amnesia, so that although they may remember the experience while it's happening, they don't remember it after the fact. It's too traumatic. Before anesthesiologists started doing this, patients report things like, oh my God, I was awake while you guys were operating on me. I heard what the doctors were saying. You know, just to avoid that, um, powerful amnestic agents, uh, benzodiazepines, narcotics, or other drugs which induce amnesia are typically given to patients who are in the scary intensive care unit.
Okay.
So we found that in fact, many, particularly adults, suppress their near death experience because they've been given these drugs. And we see that, uh, so prospective studies, and as you're saying, ones which are statistically validated, are the gold standard of medical research. We published the first prospective study in the medical literature of near death experiences in children, a small study, because not that many children survived cardiac arrest. But Pin van Lommel in the Netherlands did a huge study of adults, published in the Lancet, the world's most prestigious medical journal. Very similar to our study, prospective, identifying patients in advance, not accepting volunteers, careful control patients. But only 17% of his adults had near death experiences. Statistically significant because his control patients really didn't have, maybe 1% of them had them. And when I looked carefully at his results, I found that by and large, his patients were more likely to be treated with these powerful amnestic results. So that's a hint that by and large, when people say, well, I was near death, I don't remember anything, probably because the drugs, uh, prevented them from remembering their experience.
That's interesting. So that was a 17% of the adults had and remembered a near death experience. And wasn't your result 24 out of 26, which would have been like a 95%?
Yes. So that's our speculation that adults are more likely to be treated with these amnestic drugs. But another idea is that I think these children are so pure. They're so innocent. They just
Mm.
say what happened to them. It
Yeah,
was
they don't
weird.
have any of those repercussions of somebody's going to think I'm crazy or the experiences that would cause someone to suppress that. Is it? I know that there's a statistic. I don't remember exactly what it is, but it's somewhere around the number of, on average, it takes an adult or a person about 20 years before they speak about a near death experience. Does that
Absolutely.
apply to children?
No, that's by and large, as I told you. Well, the children we interviewed, just because of the nature of our study, mostly had not told anyone of their experience, but that's because we're interviewing them, 3 or 4 months after the fact.
Okay.
But I think that you're right. Adults are having a hard time coming to grips with this. One of those powerful adult near death experiences is the one of Dr. Robert Kennedy, who was murdered and survived. And it took him 10 years before he was able to talk of his near death experience. And listen to what he said.
Okay.
Because he counsels now victims of of murders or parents or loved ones. He said, "What I learned from my experience is we do not die alone, as you would fear. That your loved one who has died in the most horrific circumstances, perhaps, does not die alone, but dies immersed in a sea of love, a love that taught me that the meaning of this life is to learn to love like that, or even more
Wow.
important, to learn to be loved. It took him a long
Mm.
time to come.
And that was because he left his body while he was being attacked. Is that right?
He completely left his physical body while he was being murdered. He was
Right.
able to sort of almost dispassionately. In fact, he had tremendous compassion for the man who was trying to murder him. Well, he was in a sea of love. And he came back to life because this will tell you everything you need to know about the neuroscience of near death experiences. Because remember, I told you that your brain dies. It has to die to permit the near death experience. It doesn't have to die for other spiritual experiences because we're born with the same, neurological pathways which allow us to see. We have those same pathways which allow us to interact with what people call the soul of the universe or God. But here's what happened to him. He said that he was out of his physical body and he was in what seemed to be a tunnel that was filled with fog. And his son came to him and he said he heard a voice, but it didn't speak with words. Of course, it didn't speak with words. He couldn't understand words anymore. He didn't have a functioning brain that could process words. He said, no, it didn't speak with me words, but it shot a question like an arrow into my heart. And the question was, are you ready to come yet? And he thought about it and he looked at his son and he said, and I replied to that voice just as it talked to me, not with words, but with my heart. And I said, heck no, I'm not ready to come yet. So, again, that tells you they're not, even during this spiritual experience, you're no longer communicating in the ordinary way that those of us who have functioning brains interpret. And there's a woman named Lisa Smart who's done a very careful analysis of the words that people use on their deathbeds. And it has this same spiritual flavor. It wasn't, as Dr. Kennedy said, it wasn't with words, but it shot an arrow into my heart. And I answered in kind, non-verbally. So, that tells us again that these experiences are outside the realm of ordinary brain activity. Well, for the near death patient, it's obvious why, because the brains aren't working anymore. They've died. And yet
Right,
we're still
right.
alive.
All right. I have a question I want to ask you because I'm really curious about how this happened. I almost feel like this is a little bit what came first, the chicken or the egg, because you are connected in marriage to Dr. Raymond Moody, who in what was it, like 1972, somewhere, 74, somewhere around that time, he was introduced to a story of someone who had had a near death experience and he became curious, and as a physician, you as a physician, he winds up in earnest studying it. And you've known him for a very long time.
40
So
years.
40 years. So I'm going to guess at the time when you had this experience with Crystal at 7 years old, when she remembered this experience she had had before you revived her and brought her back, were you already versed in what was going to be named the near-death experiences at the time?
Never heard of it. Never heard of a death experience. When Crystal Merzlock told me this story, I thought it was the most far-fetched, crazy thing I'd ever heard.
How
That's
in the
why,
world are you in the same family with Dr. Raymond Moody and you had not heard about that? Was he not studying it yet or not talking about
it's
it?
all because of my mother.
Okay.
Okay, so well, first of all, I did have a little bit of knowledge um, because
Your audio broke out because what happened?
my mother nearly died.
Okay, okay.
And I was sitting at her bedside when the other family members were talking with her physicians as to whether they should discontinue life support and let her die. And my mother opened her eyes and looked at me and she said, Melvin, it was incredible. And then she closed her eyes, you know, and then the next day woke up. But so I had, but you have to, I mean, that was like, what a weird thing. But here's what happened. So my mother, she goes to a conference and she hears Raymond Moody talking. And she goes, my mother's like 4'10", and she's now, but she's like this dynamo of energy. So she insisted on talking, and she says, Dr. Moody, that's nothing. All those stories that you're telling, my son, the doctor, he interviews children. Children have told him these experiences. This was before we published anything, while I was doing my research. And Raymond goes, what? Your son is interviewing children? And he flew out to see me the next weekend. And we spent a weekend together talking. And he, brought me up to speed on near death experiences. He helped me to, design and refine my study. And we developed a lifelong friendship. And I ended up marrying his sister-in-law. So
How
I knew
crazy
his family.
is that?
I know. Yeah.
Talk
And she's
about
the love
no
of my life.
coincidences.
And for those in your audience, if you're in your 60s and you haven't discovered true love, don't despair. I mean, I have loved in my life, and I was married before, and those were good marriages, and they were filled with love. But I discovered the love of my life in my 60s. I
I'm
mean, that
so glad
true
that you're sharing that with
soulmate.
everybody.
Yeah. So don't despair.
Oh. Everybody has a little bit of hope.
Yeah.
Never
So
too late.
that's how I got to know Raymond Moody. But it's all because of my mother. She's
That's
kind of like,
really that's
my son, the
incredible.
doctor, very proud of me.
I love it. I love it. All right, Melvin, will you share one more experience? It can be an adult, it can be a child that really stands out that I would say blew you away.
Sure. Because I want your listeners to understand this story.
Okay.
So I studied, I published in the medical literature our research on children's near-death experiences and published books on it, Closer to the Light, so the New York Times bestseller. Um, I have all my interviews with children on my website, melvinmorsemd.com. So please, go experience these children's experiences for yourself. I was on Oprah, all that stuff. So I was well known. But I also had a busy pediatric practice. And really, you know, I sort of saw this as a sidelight. I was a neuroscientist at the time, studied the effect of various anti-cancer drugs on the brain. I had a busy private practice and worked resuscitating critically ill children. Um, so that took up all my time. Near-death experience really, wasn't a major factor. But I've always known from what Chris charged me with that these experiences are real. And then by extension, the whole spectrum of spiritual experiences are real. So we published a book and published in the medical literature that we all have a God spot. We all have the neurological hardware to have these experiences. They're as real as any other human experience from a modern scientific point of view. That was my, that was my grand intellectual conclusion. So I'm in my office, seeing my usual, 40 patients a day, ear infections, you know, patient after patient. And this couple comes to see me. And, as typically there's no child there, but, so how can I help you today? And they said to me, well, it's been over 1,000 days since our son died. And we want to know, what happened to our son? Why? I mean, is there life after death? Is our son in a safe place? What can you tell us? As, many parents, that's a common thing that nurses in the hospital, one nurse at the hospital told me, she said, my son died and you guys tried to resuscitate him. And your research was so comforting to me because I felt so guilty that I let you stick all those tubes in him and all the invasive, painful procedures that we do to dying patients. I felt so guilty, this nurse told me, but I realized from your research that my son was filled with love when that was happening. So this is not an unusual question for me. And I struggled how to answer them. And they had been to Brian Weiss's workshops. They had been to Raymond. I mean, they're going from one place to another. And my own assessment of this issue of our experience is real tell me that we ourselves can answer these questions. I don't have anything against mediums. I know Suzanne Geisman really well. Um, sure, you can go see a medium, but you can also cut out the middleman and have these experiences yourself. Anyway, but that's what I've subsequently learned. All right. So they're like, and I'm like, I don't know how I can answer this. And plus, I got 5 patients waiting in the waiting room. Suddenly, I'm called to the hospital. And These parents are so grief-stricken. They're saying, this is our son. Look at him. Take his picture. I said, no, I'm going to be back. I just got to run over to the hospital to resuscitate a patient. They said, no, take his picture with you. And they stuffed it in my pocket. I guess maybe they thought I wasn't going to come back or whatever. Went over to the hospital. As a critically ill, newborn, the separation of the placenta, preeclampsia. But we successfully resuscitated the baby. So then I'm writing up my notes, and the nurse looks at me and she says, "So who's that medical student with you today?" Like, well, there's no medical student with me today. I was, professor of pediatrics at the University of Washington. The nurses were used to me having medical students trailing me around. I said, no, we didn't have a medical student today. You must be mistaken. She said, no. When you came from your office, the medical student followed behind you and then came out of the delivery room. And then she sees the picture in my pocket and she says, that's him. That's the medical student I saw. Wow. I went back to the office and I looked at those parents and I realized that their son had been trying to communicate with them all along, but they were so filled with grief that, that the pathways were clogged, that far from the idea that grief causes these hallucinations, they're so filled with sorrow and anger and displaced anger and fear and frankly, the loss of meaning of the universe. They are no longer able to hear spiritual feelings and intuitions. And I knew that that's why this young man was following me around, is he wanted me to somehow connect him with his parents. So I said to those parents, I said, I know your son wants to talk to you. And, at that time, I wasn't big on mediums. I now see, sure, a grieving parent who has no other way. Of course, they need a third party to help them. And, and at that time, I thought, well, mediums are con artists. But then I've met people like Suzanne Giesman, who's the real deal. And I've done my own study of mediums and shown they're the real deal. So I told these parents to return to their home in New York. I asked them to get involved with a group called the Compassionate Friends. And I asked them to start to learn to meditate. And I said, before you go to bed at night, I want you to ask the universe a sincere question. And that question for them was, where is our son? Is our son still alive? And I said, first thing in the morning, before you think, quickly write down everything that comes to your mind. And this is not a technique that I made up. This is something actually I got from the Compassionate Friends. In my work with grieving parents and hospice work in general, journaling is a great way. So these parents did that. They returned to New York, and within a week, they had the experience of their son appearing at the foot of their bed and saying, "Mommy, stop crying. I'm okay." And that mother told me that for the first time in 1,832 days, she slept through the night. And that doesn't surprise me. In theory, in my intellectual work, in my academic writing, I knew that these experiences are real, but to actually experience it myself, a nurse who I knew for 20 years, who's worked with me resuscitating dying patients as a team member for 15 years, tells me that she sees a medical student that looks exactly like the picture in my pocket. I knew it was a real experience. And I knew that I could help those parents so that they could have a real experience because their son wanted to talk to them. All that had to happen was for them to be able to push their grief aside and let it happen. Let the healing start.
Wow. Melvin, I am so glad I asked you that question. As you were telling the story of being in the hospital and that nurse explaining that she saw the medical student with you, as you started to say that, I got head to toe waves of chills as you said that. I'm getting them
So,
again.
yeah, which
That's
just,
powerful.
I'll just tell you that, everything to my mind has to be filtered through science. The God spot is in our right temporal lobe. The God spot is our portal to the universe. And that happens to be the area of the brain which is right next to those mechanisms that give us chills, which give us those creepy feelings on our skin, which interestingly enough also trigger smell. The English used to say the true psychic experience is the smell of lavender.
Hmm.
Well, the area of our brain which permits us to have those types of smells or the experience you just described is right next to these deep areas in our right temporal lobe. So I have no doubt that you had some sort of true communication, probably with this young man. And your brain is letting you know that by, the secondary effects that such a communication would cause, which are those chills.
All right. I have been dying to ask somebody this question for many, many, many years, and you've kind of already answered it, but I want the final confirmation for it. I get the most unusual sign. I've never talked to anybody else who gets this, but it's taken me years to understand what it's related to. But when somebody is telling a spiritual truth, I will get this effect where it feels like only in my left ear, it feels like the hairs are standing on end inside of my ears. And whenever it happens, I can be listening to a podcast, somebody can be telling me something, it can just be in my normal life. And whenever that happens, I pay close attention because I know I am without a doubt hearing a spiritual truth because it's been probably 15 years trying to figure out what it is. And then as soon as the truth is done, it'll go away. What is that? What is happening to me?
I love that you told this story. Okay, so the right side of our brain controls the left side of our body. The
Okay.
left side of the brain controls our right side of the body.
Okay.
So that area of the brain, which causes, we have areas of our brain that allow our arm to extend. We have areas of our brain that are coded for thoughts and, language, smells, visual experiences. That area of the brain, which allows us to have the bumps on the skin, the hair standing on edge, etc. That's the area of the brain which is directly next to our right temporal lobes. So, of course, this is happening in your left ear. And it just tells us that your God spot is working.
I love it.
That your God spot. And do you have time for? I'll tell you a quick story.
Yes, yes, yes,
I've
I
got a
absolutely do. Yes,
I've got
please.
a friend named Vernon Neppy. He taught me most of this stuff. He's a professor of neuropsychiatry at the University of Washington.
Okay.
So Vernon did a lot of this research on the God spot and showed that in fact, there are physical correlations, when our God spot is activated, not just that, you know, not just that we're having spiritual experiences, but there's also, well, like you had, these are replicatable, anatomically correct. They fit within modern neuroscience, this isn't the prickly heavy hairs in the skin, but that same area of the brain also codes for unusual smells. So Vernon is out on the coast of Washington, and he's at this lighthouse, and there's this lighthouse keeper there. And so Vernon's very interested. What's it like to live in a lighthouse? Where you're not with any people. It's just the lighthouse keeper and his wife are there basically alone for 6 months out of the year. And the guy says, "Oh, it's no big deal. I'm always smelling these wonderful smells. This is just the most wonderful place. I'm always smelling lavender." And Vernon's looking around and he doesn't see any flowers. He doesn't see any plants. And then it comes to him. So he looks at the guy and he says, "So tell me about your dreams that come true." Because Vernon correctly knew that this man's right temporal lobe, God spot, was working. And, that's one of the pathways which allows us to have dreams that come true. And just as an aside, I, inspired by Vernon, I did a study with the Southwest SIDS, Sudden Infant Death Coalition, and we in fact showed that parents who have children who tragically die of sudden infant death have very specific dreams alerting them to that fact. Why is that important? Why would it be important that they have premonitions and that we can validate those premonitions as real? Because any parent who's lost a child knows that it destroys your sense of meaning of the universe. Life no longer has meaning. When a child dies before a parent, it's an offense to nature. And yet, if they have a premonition and they can trust the premonition as real, it can then restore that sense of meaning. It can flip them on a pathway to learn that grief is growth. And I don't want to trivialize how hard it is. I don't have a child who's died. As a critical care physician, I've counseled many dozens of parents whose children have died in a painful, difficult journey. And yet, if they've had a premonition and they have the courage to believe their premonition, and now we know science has got your back. Science tells you your premonition was real. And like our Southwest SID study, we can even tell you the difference between a vision that is real and one that's induced by fear and anxiety. And if that can then create a sense of meaning and that can restore, well, you're never going to get over the death of a child, but at least it can restore some sort of normal function and normal belief that this life is meaningful, that we are here to learn lessons of love. As Dr. Kennedy said, our mission in this life is to learn to love like that light that we will all experience when we die. Or more important, learn to love, to accept the love that others have for us, which frankly for me has been difficult.
Wow, Melvin, powerful, powerful stuff. Thank you
you.
so much for sharing all of this. I would imagine that there are people who are watching right now who want to learn more. They want maybe to connect with you with one of your books or maybe look at some of these studies that you've done. So how can people
Connect
connect
with
to
me
those?
personally. I'm retired now. Um, I have personally heard, like I told you earlier, a child look up at me and say, "That was weird. You sucked me into my body." So I know firsthand that these experiences are real in a way that reading books and reading medical journals just can't do it.
Yeah.
So my website, it's Melvin Morse, MRSE, MD.com.
Okay.
You could contact me through there. You could see the children's experiences, or when I was on Oprah, etc. But I have another website that I hope you put up for your listeners. It's um, I have a scientific organization, the Institute for the Scientific Study of Consciousness, and
Okay.
it's like the letter I, S like Sam, S like Sam, C like cat, USA.org.
Okay.
And, that's just chock full of information. We have our recent study of mediumship. So if people are wondering whether mediumship is real, at least to my knowledge, this is the first truly scientific study of mediumship sponsored by the Bigelow Foundation. And we present that. Anybody can download our study uh, on sscusa.org. So please
Okay.
get in touch with me.
Well,
If you're
put
struggling to
those
understand,
two, I'll put
I
those
understand.
two websites in the show notes for the people so that they can connect with you.
You bet.
Melvin, this has been a delight. I never know what to expect when the day comes around and I've got an interview on my calendar. And I have thoroughly enjoyed this conversation. And I want to thank you for the tireless commitment that you have made to helping people understand that there is more to this life than this experience that we are going through in this human incarnation, and that we live on because you are affecting so many people and giving people hope and sharing the true joy that can come with knowing that our loved ones really and truly do not die. So thank you so much for your work and what you're doing to help affect the
I've
collective
got to
consciousness.
take another minute to thank you. And for your listeners, I never
Aw.
met Lori before today. This is not a commercial. I do these types of things. I'm happy to talk for free. If people, hire me or I give lectures at hospice, I always donate the money back. But science can't do it all.
Oh,
We need people like you, Lori, who are going to help people to understand how they can distinguish their true spiritual intuitions from, of course, anxiety and fear and, our lack of faith. Of course, those can cause us to have doubts. And of course, those can create horrible, often negative experiences. So, how can we sort all that out?
yeah.
We need people like you and the amazing work that you're doing and the workshops that you give. You hearing a scientific lecture like this isn't going to do it. You got to be immersed in a weekend and really sit with a spiritual guide and learn to uncover, what is your true connection with spirit. So thank you.
Amazing. Oh, that's wonderful. Thank you so much for saying that. And I want to thank everybody in the audience for watching. Next up, check out this playlist of other NDE interviews. Please like and subscribe. It really helps this channel to grow so I can bring you more content. Thank you for watching. I'm so glad you're here.